HIV-associated dementia, also called HAD. HIV-associated dementia results from infection with the human immunodeficiency virus HIV that causes AIDS. HIV-associated dementia can cause widespread destruction of the brain's white matter. This leads to a type of dementia that generally includes impaired memory, apathy, social withdrawal, and difficulty concentrating. People with HIV-associated dementia often develop movement problems as well. There is no specific treatment for HIV-associated dementia, but AIDS drugs can delay onset of the disease and may help to reduce symptoms. Huntington disease is a hereditary disorder caused by a faulty gene for a protein called huntingtin. The children of people with the disorder have a 50% chance of inheriting it. The disease causes degeneration in many regions of the brain and spinal cord. Symptoms of Huntington's disease usually begin when patients are in their 30s or 40s, and the average life expectancy after diagnosis is about 15 years. Cognitive symptoms of Huntington's disease typically begin with mild personality changes, such as irritability, anxiety, and depression, and progress to severe dementia. Many patients also show psychotic behavior. Huntington's disease causes chorea, involuntary jerking, arrhythmic movements of the body, as well as muscle weakness, clumsiness, and gait disturbances. Dementia pugilistica, also called boxer syndrome, is caused by head trauma, such as that experienced by people who have been punched many times in the head during boxing. The most common symptoms of the condition are dementia and Parkinsonism, which can appear many years after the trauma ends. Affected individuals may also develop poor coordination and slurred speech. A single traumatic brain injury may also lead to the disorder called post-traumatic dementia. Post-traumatic dementia is much like dementia pugilistica, but usually also includes long-term memory problems. Other symptoms vary depending on which part of the brain was damaged by the injury. Let's discuss what other conditions can cause dementia. Doctors have identified many other conditions that can cause dementia or dementia-like symptoms. Examples of these include reactions or side effects to medications, metabolic problems, and endocrine abnormalities such as thyroid disease, hypoglycemia, too much or too little of sodium or calcium, or the inability to absorb vitamin B12. Nutritional deficiencies such as thiamine, vitamin B1, vitamin B6 or B12, and severe dehydration. Infections such as meningitis, encephalitis, untreated syphilis, and Lyme disease. Poisoning such as exposure to lead or heavy metals, alcohol, recreational drugs, or other poisonous substances. Brain tumors as well. Heart and chronic lung problems disease that prevents the brain from receiving adequate oxygen, which can starve brain cells. It's important to know that there are conditions that are not dementia. First, age-related cognitive decline. As people age, they usually experience slower information processing and mild memory impairment. In addition, their brains frequently decrease in volume and some nerve cells or neurons are lost. Some people develop cognitive and memory problems that are not severe enough to be diagnosed as dementia, but are more pronounced than the cognitive changes associated with normal aging. Although many patients with this condition later develop dementia, some do not. People with depression are frequently passive or unresponsive, and they may appear slow, confused, or forgetful. Delirium is characterized by confusion and rapidly altering mental states. The person may also be disorientated, drowsy, or incoherent, and may exhibit personality changes. Delirium is usually caused by a treatable physical or psychiatric illness, such as poisoning or infections. Patients with delirium often, though not always, make a full recovery after their underlying illness is treated. So what causes dementia? All forms of dementia result from the death of nerve cells and/or the loss of communicating among these cells. The human brain is a very complex and intricate machine, and many factors can interfere with its functioning. Researchers have uncovered many of these factors, but they have not yet been able to determine how to fit these puzzle pieces together in order to form a complete picture of how dementia develops. Many types of dementia, including Alzheimer's disease, Lewy body dementia, Parkinson's dementia, and Pick's disease, are characterized by abnormal structures called inclusions in the brain. Because these inclusions, which contain abnormal proteins, are so common in people with dementia, researchers suspect that they play a role in the development of symptoms. However, that role is unknown, and in some cases the inclusions may simply be a side effect of the disease process that leads to dementia. Genes clearly play a role in the development of some kinds of dementia. However, in Alzheimer's disease and many other disorders, the dementia usually cannot be tied to a single abnormal gene. Instead, these forms of dementia appear to result from a complex interaction of genes, lifestyle factors, and other environmental influences. Lewy body dementia is sometimes called Lewy body disease. Nearly 75% of those diagnosed with Lewy body dementia experience hallucinations, often seeing people or animals that aren't there. Doctors employ a number of strategies to diagnose dementia. It is important that they rule out any treatable conditions such as depression or vitamin B12 deficiency, which can cause similar symptoms. Early, accurate diagnosis of dementia is important for patients and their families because it allows early treatment of symptoms. For people with Alzheimer's disease and other progressive dementias, early diagnosis may allow them to plan for the future while they can still help make decisions. These people also may benefit from drug treatment. Doctors have devised a number of techniques to help identify dementia with reasonable accuracy, such as asking questions about the patient's history, physical examinations, neurological evaluations, cognitive and neuropsychological tests, memory, language skills, math skills, problem solving, brain scans, and magnetic resonance imaging, laboratory tests, blood tests, urinalysis, toxology screening, thyroid tests, etc., psychiatric evaluation, and pre-symptomatic testing or genetic tests. While treatments to reverse or halt disease progression are not available for most of the dementias, patients can benefit to some extent from treatment with available medications and other measures, such as cognitive training. Drugs to specifically treat Alzheimer's disease and some other progressive dementias are now available and are prescribed for many patients. Although these drugs do not halt the disease or reverse existing brain damage, they can improve symptoms and slow the progression of the disease. This may improve the patient's quality of life, ease the burden on caregivers, and/or delay admission to a nursing home. Many researchers are also examining whether these drugs may be useful for treating other types of dementia. Many people with dementia, particularly those in the early stages, may benefit from practicing tasks designed to improve performance in specific aspects of cognitive functioning. For example, people can sometimes be taught to use memory aids, such as mnemonics, computerized recall devices, or note-taking. Behavior modification, rewarding appropriate or positive behavior, and ignoring inappropriate behavior, also may help control unacceptable or dangerous behaviors. Research has revealed a number of factors that may be able to prevent or delay the onset of dementia in some people. For example, studies have shown that people who maintain tight control over their glucose levels tend to score better on tests of cognitive function than those who poorly control diabetes. Several studies also have suggested that people who engage in intellectually stimulating activities, such as social interactions, chess, crossword puzzles, and playing a musical instrument, significantly lower the risk of developing Alzheimer's disease and other forms of dementia. Other preventative actions including lowering homocysteine amino acids, lowering cholesterol levels, lowering blood pressure, exercise, education, controlling inflammation, and long-term use of non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and similar drugs. People with moderate and advanced dementia typically need round-the-clock care and supervision to prevent them from harming themselves or others. They also may need assistance with daily activities such as eating, bathing, and dressing. Meeting these needs takes patience, understanding, and careful thought by the person's caregivers. A typical home environment can present many dangers and obstacles to a person with dementia, such as sharp knives, dangerous chemicals, tools, and other hazards which should be removed or locked away. Safety measures include installing bed and bathroom safety rails, removing locks from bedroom and bathroom doors, and lowering the hot water temperature to approximately 120 degrees Fahrenheit, or less to reduce the risk of accidental scalding. For individuals with Lewy body dementia, it's important to understand that the hallucinations they are experiencing are very real to them. Trying to explain that they are not real to them can only cause the individual to become irritated and agitated. It's best to go along and accept it with them, so long as you and the individual are not in any physical danger. People with dementia often develop behavior problems because of frustration with specific situations. Understanding and modifying or preventing the situations that trigger these behaviors may help to make life more pleasant for the person with dementia as well as his or her caregivers. For instance, the person may be confused or frustrated by the level of activity or noise in the surrounding environment. Reducing unnecessary activity and noise, such as limiting the number of visitors and turning off the television when it's not in use, may make it easier for the person to understand requests and perform simple tasks. Confusion also may be reduced by simplifying home decorations, removing clutter, keeping familiar objects nearby, and following a predictable routine throughout the day. Calendars and clocks also may help patients orientate themselves. Normal leisure activities, as long as they are safe and do not cause frustration, such as crafts, games, music, and exercise, and other intellectually stimulating activities, may slow the decline of cognitive function in some people. Let's summarize our discussion with what research is being done on dementia. Research on the causes of Alzheimer's disease and other dementias, including studies of genetic factors, neurotransmitters, inflammation, factors that influence programmed cell death in the brain, and the role of tau, beta amyloid, and the associated neurofibrillary tangles and plaques in Alzheimer's disease. Since many dementias and other neurodegenerative diseases have been linked to abnormal clumps of protein in cells, researchers are trying to learn how these clumps develop, how they affect cells, and how the clumping can be prevented. Researchers are searching for additional genes that may contribute to Alzheimer's disease, and they have identified a number of gene regions that may be involved. They are also continually working to develop new drugs for Alzheimer's disease and other types of dementia. Many researchers believe a vaccine that reduces the number of amyloid plaques in the brain might ultimately prove to be the most effective treatment for Alzheimer's disease. Current research focuses on many different aspects of dementia. This research promises to improve the lives of people affected by the dementias and may eventually lead to ways of preventing and curing these disorders.